Welcome to our fillers webinar, and thank you everybody for joining. I can see that there's a lot of people who've joined this webinar, a lot from the private clinic and a lot from the Cosmetic Skin Clinic. So thank you for joining this evening. So the purpose of the filler webinar was because we've run some webinars before on some other treatments we provided, like therapy and cool sculpting. And actually they were so well received, we decided to do a fillers one and try and dispel some of the myths about fillers. So we're just going to tell you a little bit about ourselves and then move swiftly on to the webinar. There'll be a lot of opportunity for Q&A. So please put your questions in the chat and we will try and answer as many as we can at the end of the webinar, but do it as a webinar run so that we can have a look at what's going on and what's being asked. So let's move swiftly on. Next slide, please. So a little bit about us. We're a non-surgical clinic. We have a number of clinics across the UK. I've been in the industry for 30 years and I've seen a lot during that time, but the consistent thing throughout that time has been the use of fillers and how they have evolved to create better and better and better results over the years. So what we're seeing now is this fantastic approach to anti-aging, and today we're going to be discussing that very thing. Next slide, please. But the treatments and the success of treatments and the quality of filler treatments are all about the people that provide these treatments. And this is the Cosmetic Skin Clinic team of advanced injectors, people that you'll see if you come into clinic or if you have a consultation. And on the next slide, these are the private clinic advanced cosmetic injectors. So these are the people you'll see if you go to the private clinic. And these are the people that you're going to discuss treatments with, what might be appropriate for you, and the way they go about addressing your needs and achieving your goals. Next slide, please. So the way the webinar is going to run, because this is all about getting as much information out there to you as possible in the best way, with transparency and honesty, so that you can go away from this webinar thinking, okay, I actually am armed with a lot more information than I was before. I'm going to open up with a couple of public perceptions and insights, which are quite interesting, then talk about what are fillers, bust some myths, because there are so many myths about fillers. We're just doing 5 in this webinar, but you can put in the questions or the question box, just ask us about anything else and we'll answer it. We're going to throw into this a few videos as well. So just to warn you, there will be some live injecting videos, and if anybody is a bit squeamish, there will be some treatment videos. So I will warn you before, and then we'll go into a before and after gallery, which demonstrates the kind of work we can do, and then the live Q&A. So without further ado, the next slide, please. So what did a recent study show? And there's Saying, which is a filler company that is probably one of the best known, did a very interesting survey. And they found that the drivers to having injectable fillers actually is about being more confident, looking better, feeling better, and confidence was the #1 reason why people actually decided to go ahead and have filler treatment. People weren't obsessed with anti-aging and looking dramatically glamorous. What most people want to do is just boost their self-esteem and boost their self-confidence, which is a very good message. Next slide, please. And what they found was when they asked what people considered attractive, a natural looking appearance was absolutely what came out as #1. And that's really interesting because, again, I think there's this complete divide between, in the past, what the public perception of having fillers was, but together with what the reality is. Because today we will show you the reality is actually very natural. It's a barely done look. It's about literally enhancing the best of someone, but still keeping someone looking the same, being able to smile, move, emote naturally, all the things that we identify with being attractive. Next slide, please. So we have to have a tiny bit of science. In my day, when I first started injecting 30 years ago, we used to inject collagen. And nowadays, everything's changed, and it's changed for the better, because we underwent during that time a complete evolution of what fillers should be made of to make them safe, to look natural, to move with our face, to not look done. And hyaluronic acid is what the majority of fillers are composed of nowadays. It's used in skincare, it's found naturally in our bodies and in our skin, and it's that product or that component that makes our skin look firm, youthful, fresh, dewy, and elastic. And over time, not only does the collagen break down, but the hyaluronic acid breaks down, causing the classic signs of aging, smile lines, wrinkles, slackening of the jawline, all of those things that we associate with age. Next slide, please. How do they work? Well, in the past, we were not as sophisticated as we are now. In the past, when we used to inject fillers, we literally would just chase the lines. We just fill in little lines, fill in little smile lines, and that was all we could do. Nowadays, you'll see from the videos we're going to show and the photographs we're going to show, we actually have a much more sophisticated approach to anti-aging. We know that where we lose volume, we know where we have to put the support in to actually rebalance the face. And the majority of the time, it's the shape of our face that changes as we age. It's not necessarily the tiny detail that we're looking at. We're looking at shape and beauty and the balance of the chin to the lips to the nose, the cheeks to the nose. This balanced look is the most beautiful. And that's what we're trying to restore when we're actually injecting fillers nowadays. Next slide, please. So going back to what I said, what areas can we treat with dermal fillers? The answer is quite a lot of areas now. And in experienced hands, these are actually very safe treatments, and we'll be touching on this later. So in very, very experienced hands, we can do all kinds of things. In the younger patient, of course, not much is needed. Little bit of lip enhancement, maybe a little bit of chin enhancement if there's some imbalance in the chin or jawline. So very subtle, nuanced treatments. As we get into middle age, it's about restoring and correcting signs of aging often, temple hollowing, supporting the cheeks, giving what I call the coat hang on. You'll see this later. If we actually support from the top, everything looks nicer and more balanced and more attractive. And by doing that, we can actually soften the nose to mouth lines. We can actually just put filler right at the back of the jaw here to give more lift and support to the jawline. Again, very subtle results, but they look together as a whole, they look really beautiful. And nowadays, thankfully, men are actually embracing non-surgical work more and more. And certainly in our clinics, we're seeing this coming through. Over the past 5 years, we've seen more and more men coming through the doors, having all kinds of treatments. Again, men want to look natural. Men want to look good. They don't want to look like they've had nothing done. They don't have the benefit of wearing lots of makeup to cover up bruises or marks. They don't want anything that's going to mark them in the short term. And we'll show in a minute again after treatment that fillers nowadays leave barely any marks, even immediately after treatment. So we can actually deliver great results for men. Next slide, please. So let's start off busting some myths. There'll be a lot more myths, as I hope your question is about. I really do hope you challenge our thinking later on today. But let's start to bust a few myths. So let's get the first myth up. And I'm joined today by some of my experienced cosmetic practitioners. There's 4 people online with me today that we're going to be asking some questions of. So the first question is, fillers will always look obvious, so it's not a question, it's a myth. Fillers will always look obvious and unnatural. So I'm going to throw this out there to Joanna Christou, Dr. Joanna Christou. Joanna, what have you got to say about this?
Thank you, Tracy. So good fillers that are well done in experienced hands with a practitioner who has a fantastic aesthetic eye and understands the anatomy will never be obvious and will never look unnatural. The patient will look good from every angle, with every emotion and every expression, but will leave that question, hasn't she actually had any work done? And that's a sign of a really, really good treatment.
No, so that's put really well. And again, at the end, we'll talk about this because a lot of patients say, but do you know what? How come so-and-so looks so overdone? And they'll mention a celebrity, won't they? And say, if they've got access to the best of the best, why do they look so dramatically different? And perhaps we can just compute that and talk about that later. But that was beautifully put. Thank you. Can we have myth 2? So, Lee Garrett, dermal filler treatment is painful.
Thank you, Tracy. And no, dermal fillers are not painful. In fact, many of our patients often after treatment say to us that that was a very comfortable treatment. And to that degree is that the companies that make the dermal fillers have actually added a treatment to make it even actually a lidocaine, which makes the dermal fillers much more comfortable. So in fact, no, they're not painful at all.
No, I think this is a really big myth, isn't it? And I think it might have come from in the past, treatments that weren't as comfortable. We're going back 10 years now. Nowadays, it's easy, isn't it, or relatively so? Yeah, thank you. Myth 3, please. Let's bust a myth. This is a biggie. Fillers are unsafe. Dr. Joanna Ward, what would you say about this myth?
So I would say that they're incredibly safe in experienced hands. As you alluded to in your presentation, they're made of high hyaluronic acid, which we have naturally in our skin. So in expert hands with FDA approved, really high quality fillers, I think they're safe, effective, they beautify, enhance, and can give a huge boost to your confidence.
Yeah, it's great. And again, we can always expand on this later, can't we, if people are concerned. But nowadays fillers, they're so safe. Again, in experienced hands is the thing I'll always say. Myth 4, please. I'll answer this one. I'll answer this one purely because I've spent my whole life enjoying treating all kinds of age categories. I don't believe anyone is too old for fillers. I believe that what we are striving to achieve in a more mature patient is different to what we strive to achieve in a younger patient. It's all about expectations, and it's all about being, age appropriate is what I say. There is nothing worse than putting, a 30-year-old's lips onto a 70-year-old face. And that is not what it's about. It's about keeping treatments age appropriate and in keeping with the person. So for my money, no, you're never too old for fillers. It's just about doing it properly, conservatively, and well. And if you do it that way, it can still look absolutely superb. So myth number 5. When fillers wear off, my lines will look worse. I've heard patients say this, and I've heard patients who are concerned about this. So Tara Jackson, what do you have to say about that?
Oh, hello, good evening, everybody. Strangely, the opposite is true. As Tracy has said, we use FDA-approved fillers that last somewhere between 12 and 18 months, and your body will naturally metabolize them. So if you stopped having fillers after that, you will just age forward. And in fact, the data and the science shows after decades of injecting them, you often look better. You will never go back to baseline before you had your filler.
Yeah, that's something people do get confused about. And again, we know that collagen stimulatory effect that fillers have, and people don't realize that, but it's very exciting. And a lot of studies have proven that, which is, very, very interesting. Thank you very much for myth busting, but there's so many more myths that we could bust later on. So next slide, please. So we thought we'd just show you a few treatment videos. We have a lot, but we just selected a few just to give a little snapshot of how fillers look. Now, just to remind you a couple of things. Again, it's showing live treatment with needles or cannula, so just be aware. And the other thing is the sound. You may need to turn the sound up a little bit because the videos, for some reason, are playing a little bit quieter than our presentation. So just to warn you. But the first video will be just with Dr. Christou, just talking about the concepts in the clinic that we have when we treat our patients, what we're trying to achieve for each and every patient. So if you could roll this video, please.
One thing I think about when patients come to see me in the clinic is how to look beautiful from every angle. Now, a lot of people come to us with very specific concerns, but what we need to address is the holistic big picture, because some treatments might have a knock-on effect on others, and it's the combination for the individual that's right for them, so that on assessment we can see from every different direction a brightness, a healthiness, a youthful glow to the face. So each area of the face is connected to the other. No one area should be taken in isolation. If treatments are taken in isolation, it can unbalance the face. So for example, a patient may be concerned about thinning of the lips. They may want fuller, more luscious lips, and that's fine, but we have to take that into the context of the full face. From every angle, does it look right? Does it look pretty? Does it look beautiful? And so yes, we can do the lips, but the patient may also need, for example, projection of the chin or projection of the cheek to balance the overall profile for that patient. And we take the age of the patient, the skeletal balance of the patient, and we create a bespoke treatment plan to achieve what they want and looks right for the patient overall.
Yeah, that's a lovely overall assessment of what we do. And in fact, I was speaking to, you know, every day we talk to people. I was speaking to my hairdresser recently, and she'd had some treatment done and showed me. And what I was trying to explain to her was exactly that. It's about the balance, getting everything right. And we are tuned into millimeters of difference. Visually, we're tuned into this. If the top lip is slightly too full, if there's something slightly out of kilter, if from the side profile it's not quite right, our eyes are tuned into that and we can see it. And it's amazing. We know what, you don't have to be classically looking a certain way, but we all know what lovely, beautiful aesthetics looks like, whether male or female. So our job is to try and get that balance bang on so that it looks absolutely fantastic. Next video, just the holding. So this one, before we play it, is Tara. She's showing that actually we're going to be showing you a number of things tonight. We're going to be showing you the whole spectrum. We're going to show you how just 1 ml of filler can make a very big difference the way a patient looks and feels. And we're going to take you all the way through to how multiple syringes of filler with a multidisciplinary approach, which I'll explain later, can actually give results similar to surgical facelifting. But this one is a beautiful intro, and what this shows is exactly what it says. Small changes can make a big difference. So let's roll the video.
So tell me what Claire came with, what her concerns were and how you addressed it relatively easily.
We did have to prioritise with her budget. So what I felt, yes, this was an issue, but what also was an issue was that Claire was a little bit empty here. And again, as we're talking about this cheek pad here, once we start to lose this, it starts to allow the skin, it's got nothing supporting it. So it's starting to drape.
Yeah.
So what we've done is just carefully placed products, filler in the correct area. So we've given, again, a little bit of support out here laterally and then just under the eye. And we've had a lovely result here with just 1 syringe of filler.
That's hardly anything, really.
Remember, it's 1/5 of a teaspoon.
Yeah, that's incredible.
Yeah.
But again, what you're basically saying, if I'm hearing you right, and of course I know this, is to do with being, again, highly visual, knowing what you're doing, and placing this product correctly so that you get best aesthetic outcome. And can I ask you, Claire, can you see the difference?
Oh, there's been a tremendous difference. I'm absolutely thrilled with the results.
Good.
You know, for a procedure which took all of a few minutes, was relatively painless, in fact completely painless. I think the results are incredible and very noticeable.
So that's minimal intervention with maximal gain. And actually, if you deliver that with a patient, then everyone's happy. I mean, that's great, isn't it?
Lovely video, Tara, and I know you probably want to talk about this one, but I'm going to keep the pace of the video up. People, you can always talk about it later. The lovely change, and what you have to appreciate subtlety here, but this is a very good looking woman, and what this has just done is just slightly lift that cheek volume up, hasn't it? And the tear trough and the cheek tend to separate, don't they, as we age, Tara? Can I just can we just take you off mute just for 1 sec? And if you can just say, this is a very, very nice result, but that's what you've done, haven't you?
Yes, so Claire was just feeling that she was losing that volume, her face was looking a bit flat. So with 1 ml of dermal filler, we've given her some contour back into her face, and that's in that sequence will support the eye so it looks less tired, and then it gives a little bit more width to the mid face rather than the width being here, which is always a rather sort of aging look, and we look more, always look more youthful and prettier when our cheeks are slightly wider here.
Yeah, lovely, lovely result. Next slide, please. Thank you, Tara. Next slide, please. So this is giving lift to a tired face. This is quite a quick video, but again, this is showing this person did not want to look very different at all. They just wanted a little bit of a zhuzh. And this proves that you don't need to go crazy to, again, be happy with the treatment that you receive, just to freshen up a tired, careworn face. Can you roll the video, please?
I'm so glad that it looks natural, and I just feel more lifted. Yeah, I don't feel so saggy. Yeah, I feel more glowy.
Lovely result.
Yeah, very nice result. And you see the before and after. And again, very subtle, but the jawline looks cleaner, looks more defined. Also, what fillers can do, and I don't think you can see this so clearly, but it's very true, and the practitioners can talk about this later. Weirdly, by contouring the face better, often you can get the face looking slimmer and slightly more contoured, but slimmer, which can be very appealing. People always seem to think fillers make faces look puffy, but actually, when we do it properly, the converse can be true. Next video, please. If you're going to go and right, this one again is Tara's. This is showing that in a younger patient, by rebalancing certain areas of the face, we can enhance and beautify. We won't talk this one through at the end, we'll go on to other, but just to show it's a very clear demonstration of how just making nuanced changes makes a big difference. Again, roll the video, please. Lovely. Have we got in the photograph of her at the end, or is that, yeah? So this again just shows that by just that most of us don't spend our time looking at ourselves in profile, but actually weaker chins can alter profile. This after photo you can see is immediately after treatment, so she looks a little blotchy, but it doesn't matter. You can see it's very minimal. So what's been done here is, and again Tara can talk about this later, but it's just a whole face approach, a little bit of adjustment to cheeks and temples, projection of the chin, and it really makes somebody who's already lovely look even fresher and more balanced. And it's that kind of very sophisticated work that's actually very artistic. You can see the jaw looks more projected, more streamlined. It's very clever injecting, actually, very sophisticated work. Next slide, please. So we're going to be just talking about the whole approach now. So my mantra is always that really when work has been done well, I hate this word work, but when treatment has been done well, it should be very difficult to perceive. We should hold a patient in aesthetic suspended animation. We should just be literally, it should be a has she or hasn't she I'm not sure whether she looks too good to actually have had nothing done, but actually I can't see that she's had anything done or he has had anything done. So it's that kind of approach that we are taking here. So when we combine, there are some patients that just using an injectable filler with the added bonus of skin tightening and lifting technology, or muscle relaxants as well, we can actually achieve results akin to a surgical facelift. So let's just look at two cases of this. We're going to look, the first one is a lady that I know very well called Maxine. She's a regular visitor to the Cosmetic Skin Clinic, and her journey with us has been 10 years. Actually, Maxine thinks it's 7, and you'll see on the video we play, but it's actually 10 years. And if we show the next slide, please. You can see here that actually Maxine came to us as a very nice looking lady in her late 40s, but with showing quite definite signs of aging, showing a tear trough, so hollowing under the eyes, loss of volume under the eyes, a slackening of the jawline. The cheek volume tends to disappear a bit as we get older, and her face took on a more oblong, a more long appearance, and that's classic aging in a patient. What we did over time was we combined treatments. We actually did treatments, injectable fillers into the temples. We actually, believe it or not, haven't injected her cheeks. I know her cheeks look fuller, but we haven't done that. We've actually, by injecting higher up on the temple and the tear trough and behind the cheek, we've managed to create a lifted effect. So her cheek volume has been restored. We also did, we treated the jawline with filler and the nose to mouth lines and just tweaked the corners of the lip up. We also then combined this with all therapy skin tightening. So if you imagine that the fillers act as like support and pillars, a bit like when you're crudely put, when you're putting a tent up, very bad, but it gives the concept. If you're putting a tent up, you have to put the tent poles in first. So if you think of the filler like the tent poles, it's literally supporting the whole face, giving support where it has been lost, where volume's been lost with the aging process. And then the skin tightening actually is like the canvas of the tent being pulled over those pillars. So you get this lovely restoration of that heart-shaped face, which is so useful and so fresh. So this lady looks younger 10 years later than she did when she first came in to see us. And she puts this so beautifully in her video. Next slide, please. And this is her chatting about her treatment.
After having my treatments today, I was chatting to the consultants and we were talking about my photos and we got them up to have a look, and I cannot believe the difference. I look younger now than I did when I came in 7 years ago. And you don't realise that actually investing and having some treatment, just a little and often even, the difference it can make to the way you look, the way you feel. I think I look younger now than I did 7 years ago, and I couldn't be more pleased.
That says it all. And to me, that, and to us all that work in aesthetic medicine, that's what gives us a buzz. It's that somebody really feels that the investment they made has been wholly worthwhile, and that's fantastic. Next slide, please. And this is the male face, and this is Sam Kane. This is Linda Lusardi's husband. For those of you of my generation, you'll know who that is. And Sam is an actor. He's been in all kinds of things. He's been in Brookside and all kinds of things. He's very well known on radio. He's a TV personality, and he's a good-looking guy. And he just wanted to look fresher. And with men, you have to keep them looking like men and looking natural, as if they've had nothing done. And you can see from the first, though the light, and I apologise for the light, that's not deliberate, but the light on the first set of shots isn't ideal, but it still demonstrates the point. Sam was losing a lot of volume, just what we call pre-auricular, just in front of the ears. And it was all his facial volume was more in the centre. And he was losing his volume by the in front of the ears. And what happens then is that everything sort of sinks forward and down. And by replacing volume just in front of the ear, very, very subtly, you can create a sort of hitch effect, again, a bit like a coat hanger. You lift the tissue up. He's also had as well, we're talking about the whole multidisciplinary approach. He's had jawline filler as well to define and chisel that jaw up. He's had a little bit of under eye filler, but he's also had all therapy skin tightening and some cool sculpting to get rid or improve his double chin. So if you get the side view, which is the next slide, you can see again, forgive me, the light is not ideal, but I think it still demonstrates the point that the guy on the right does look significantly fresher and younger. The jawline looks more youthful, the face looks more lifted. I think this is a very nice result and a very natural result for Sam, and he was very, very happy with that. So this is demonstrating that if we put technology treatments together with injectable fillers, we can often optimize outcomes, and we never rely on too much of one thing. It looks very balanced, very, very natural. Next slide, please. So what we're going to do now for the next few minutes is go through some befores and afters. We're going to demonstrate a number of treatments, and then we're going to open up for Q&A. And please challenge us, as I keep saying, there's quite a few questions that have come through, but please challenge us with any questions you want, because we are there to answer questions. We are there to give you as much information as you can. And, you know, don't make it easy on us, you know, send us some tricky ones. So let's go through the treatment results. This is a lady called Mim, and I'm going to throw this out to different people because we all know how we treat. Actually, Joanna Ward, I know this isn't your patient per se, but could you just talk us through how, you know, we've made this lady look a bit fresher? This is a lovely result because she's a good looking woman, but actually she looks even fresher in the after. Can you just highlight the areas where she does look fresher for us?
Yeah, absolutely. I think this is a really good example of how we can beautify and enhance with fillers. Again, very age appropriate. In the before picture, you can see that she's lost some of her anterior cheek volume, and she is looking rather hollow under the eye in the tear trough area. So these areas have very softly been treated. She's also got some falling forward and sagging, creating the nasolabial line, which in her is coming round from the cheek filler, and some filler to support and scaffold the tissue back just in front of the ear. When it's placed there, it's given her a really beautiful lift. And that's probably all she's had to do, just some beautification and lifting, and it gives you such an incredible age-appropriate result. Lovely, lovely explanation. She's a really pretty lady. It just looks lovely. Thank you for that, Jonna. Next slide, please. Lee, this was your patient as well. Wanted a subtle result, but it's beautiful. Yep. Can you just talk us through what you did?
Yeah, so this patient wanted to have a very natural result. She didn't want to change the way she looked. She just wanted to enhance and beautify herself and maintaining her sort of looks. So what I did is that I enhanced her cheeks, so sort of like her mid cheeks and her lateral cheeks. I contoured her jaw and also contoured her chin as well. I didn't touch her lips at all. We just sorted out the sort of barcode lines on top of the lips. But we also, when I looked at the forehead, she was lacking some shape on the lateral part of her eyebrows. So I filled those areas with dermal filler, and that just refreshed her as well. And a little bit of temple work as well, just to refresh there. And then we ended up just doing a little bit of Botox in her frown line.
Lovely, very nice result. And I think she's very happy, this lady, wasn't she?
She's very happy, yeah.
Yeah, lovely. Lovely, Lee. Lovely result. Or just softer. It looks natural, just softer, just fresher. Next slide, please. Tara, we talked through this one. This is yours. I think you spoke through this one beautifully anyway. So no more to add?
No, it's a lovely result using just 1 ml of hyaluronic acid. Obviously, you know, we could do a full face rejuvenation on Claire. You know, just for some, you know, if we wanted to give a little more tapering along the jawline and on the chin, we could have done that, but we didn't. In this case, we just used 1 ml to achieve that fresher look.
Yeah, it's lovely, lovely. Thank you, Tara. Next slide, please. Actually, Joanna Christou, could you just talk us through the approach to tear troughs? We've got 2 sets of tear troughs we're showing, again, a big area of concern for patients, and one that comes into our clinic quite a lot, actually, tired eyes. So Jo Christie, could you just answer the approach to freshening up an under eye?
Thanks, Tracy. Yeah, as you say, it's a very, very common concern and one we see every single day in the clinic here. There's a number of factors to consider because eyes do lose volume, but also what's important is the mid-face volume. Have they lost support in their cheeks? And sometimes that's a really nice starting point because, as Tara has so wonderfully demonstrated in the previous case, a little bit of mid-face volume actually goes a long way. And so we need to look at the big picture. We need to see where is the volume loss coming from. And the goal here is not to bulk, not to fill, but just sort of refresh and have the light bounce off the area, reflect off the area, so you look brighter and more vibrant, but not obviously done and obviously bulky, because I don't know if anyone has spotted those sausages under the eyes where filler is overfilled. It's not a good look, so we need to keep way under that level and just refresh and rejuvenate the area, predominantly with filler, sometimes combined with tightening, as Tracy had mentioned earlier on, these combination treatments.
Yeah, lovely, thank you. And if we show the next one, thank you, Joanna. This is another example, and again, what I like about this is it's real, it's true. You can still see this lady has a little bit of under eye, but that's in keeping with her age and natural. It's when you get these overblown puffy tear troughs that look totally unnatural, where it can all go a bit wrong. And I think what I like about this slide is it's a fair and honest representation. And that, by the way, is not an easy treatment, this one. This is a very, very technically difficult treatment, one that's easily underestimated by practitioners. It can be easy. This is very hard, isn't it? When we get that separation, that line that tracks from the tear trough across the cheek, this is very hard to correct sometimes, isn't it?
Absolutely, yeah.
Yeah, so a lovely result there in keeping with age, which I like. Next slide, please. Okay, yeah, this is a lady, again, we're talking about the whole face approach. This is a lady who had some cool sculpting to improve the double chin and to give a bit of lift, and then had some jawline and chin filler to make everything just look softer, more natural and lifted. And again, what I like about this is it's a fair, honest representation of a non-surgical treatment. You know, it doesn't look over tight. In fact, I would argue that if we probably did some skin tightening over that or lifting, we probably could get an even better result. Is this yours, Tara?
Oh, actually, this one isn't.
Oh, listen, but actually, as I say, we're not. It's not one-upmanship here. It's more about, you know, what we're all doing treatments like this every day. So it's a beautiful chin projection, very soft. And I think if you look hard enough, you can see what happens as you age is, as women, particularly, our chin becomes like cottage cheese and takes on a sort of dimpled appearance and rotates up. So the line, I don't know whether anyone can see me on this, but we can just see the video, but the actual chin cleft gets deeper as we age. We can get this sort of cottage cheesy uneven appearance, and that's because the muscle, the main talus muscle that sits in the chin, contracts and looks very obvious and pulls the chin in, and we lose volume, this soft volume that's overlying the chin. So we get this sort of cottage cheesy dimpled appearance. And as practitioners, what we do is we use combinations of treatment, often toxins, with dermal fillers to create a lovely, soft, rejuvenated look. It's pure, you know, it's lovely to do it. You can hear from my voice, when you get a great result on that, it can be really transformative and turn the clock back a good few years. Next slide, please. We're nearly on the Q's and A's, everybody. Please keep sending them in. Lips. Lips have got a bit of a bad rep, and I think understandably so, for all kinds of reasons. I will be honest, I'm not here to be, as I say, I'm not here to be a cosmetic policeman. I'm not here to tell people what they should and shouldn't do. All I can say is what I believe a beautiful aesthetic is about, and it's personal view. Our job is to try and keep people looking beautiful, whatever they look like, whatever look they have. So we don't subscribe to the big overblown lip look. We like something that just looks refreshed, age appropriate, as I keep saying, barely done, barely there. And I think this is a very nice, it's such a subtle result. I will be controversial to say, maybe some people wouldn't think it's enough, but I do. I think this is a lovely lip refresh. It's just made things look fresher, a little bit more dewy, a little bit more oomphy, but that's it. Not hugely bigger, fractionally bigger. Lovely, lovely result in a relatively younger patient. Next slide, please. And this is a hard treatment to deliver. When people naturally have very, very, very small lips, it's incredibly easy to think it's easy to get bigger lips. You know, just put some filler in, bigger lips, pa-boom. It's not. Actually, if we don't assess a patient well and we don't do the treatment well, you can just end up with lips looking like they're sticking outwards rather than lifting upwards and looking like they've been lifted and projected. So this takes really clever injecting and very good clinical assessment to get this kind of lip looking really beautiful and really good. It can look very off if it's not done well. Next slide, please. Joanna Christie, this one's yours. I mean, this poor lady looks almost like robotic in this, but it's because there's such a black background and a black headband. But actually, this is a fabulous result. Can you tell us what you did, please?
Yeah, so this lady is in her mid-50s, and in the before picture, you can just see that there's a global loss of volume, and the face looks a bit tired, a bit drawn, a bit skeletalized. She's got a bit of jowling there. So the treatment here is done purely with fillers at this stage. I've enhanced the temples, so given her some structural support in the upper part of the face, which has just opened up the eyes and brightened the eyes. I've put filler sort of towards the back of the cheek, which has pulled up the jawline, and the back of the jaw, in fact, too, which has given a bit of traction and a bit of pull back there. And then just finesse towards the front of the face, so a little bit here and a little bit into the marionette areas to support the corner of the mouth. So the idea is that no one area looks drastically different, but the overall effect, the composite effect, is a face that looks fresher and brighter and more sculpted, and she looks really healthy. She loved this result. I love this result actually too. It was very pleased with that.
Yeah, it's beautiful. Thank you, Joanna. Next slide, please. And I'm always, Tara, this is a good one for you to talk about. This is, I think, absolutely amazing and looks like a facelift result, but this is a non-surgical, primarily filler, but with other treatment modalities. Could you just talk us through this one? Because we're near the end now for the Q&A. So if you could just talk us through this, I'd be grateful. Thank you.
Yes, of course. So when Carol came to us, and it goes back to that myth, am I too old for fillers? And I think she felt that she possibly was, and was coming to us for a consultation, a non-surgical, but was actually going to see a plastic surgeon as well. But, you know, that the older you get, you just have more volume loss. So as Dr. Joanna's just explained, it's treating the whole face. So she's got volume loss and sort of what we call in her temples, her mid-face, her jawline, her eyes look tired. So I've supported all the fat pads that used to be here and now are just sitting here on Carol. So just by supporting all of those, how we did Carol's treatment was that we started, because she was in her 70s and she wanted to invest and have the best results. So we started with an oil therapy, and then we did some radio frequency microneedling, and then I started on the fillers. It's sometimes quite important to choose the correct sequence, and then we got this lovely result. Over about 4 sessions, I would say.
It's really fantastic. And the other thing I will say is this, particularly when there's quite an approach like this, which is really quite sophisticated, a lot of investment, both from the practitioner, from the patient. What is important to say to patients is this, that it takes a lot of work and time and effort and money to get to this point. But once you're there, it's easy to maintain. And I think that is going back to what we said. Once you've got this lovely collagen stimulation in the face, you actually maintain, it's easy to maintain it relatively inexpensively. It's just getting there. It's getting there, which is the thing. But beautiful, beautiful result. It's quite spectacular. Next slide, please. This is lovely. This is, forgive me, this is not deliberate. The light in the pre-treatment one isn't ideal, but it demonstrates the point. The point is that by actually softening facial features, restoring cheek volume, giving lift and support, you can actually make a nose look smaller. You can actually make some facial features blend in so that they don't look as dominant on the face. And that's what this shows, this lovely, lovely lifted effect. And also it stops the nose looking dominant on this patient. We've also tipped up the corners of the mouth and softened the nose to mouth lines. But the main impact of this treatment has been the cheek lift and the under eyes, because it's hitched everything up and it's made the nose almost disappear into the face. Next slide, please. Side profile, I'm going to whiz through these because we've got some great questions to wrap up with. A flat face. When someone's lost volume and they've got this flat look, by giving contour in the cheeks here, giving more lift and contour to the face, tips up the side of the mouth, takes a sad looking face or a tired looking face and a flat looking face to looking fresh, lifted, contoured. And can you see from this slide that when you lift a face and contour a face, it makes the face shape change completely. The face does not look as long. It looks like it's been contracted, and that is nearer to a youthful face. As we get older, we have this expression, why so long in the face? That's what happens as we get older. Next slide, please. And this is the end, but this lady sums up why we all are very biased and love fillers so very much. And then we're going to open for Q&A. So here we go. Let's just play this video and away we go.
This is me previous to my treatment, and as you can see, it's the treatment I've had of giving me my contours back again, my cheeks look healthy as it was previously before I was ill and before of aging. It's the old me.
Put beautifully, the old me. How lovely is that messaging? And we love patients to do this because it's real and it's true. And she puts it so succinctly and well. Next slide, please. So thank you very much for attending this session. It is quite lengthy, but I think we have dispelled some of the myths and talked about why we like fillers. We've been sent some great Q&As, which we're going to whip through. I'm going to just put it out there to each practitioner. Our phones are now live for those of you who wish to book any kind of consultation or have an inquiry about treatments or have any further questions. This is the line to ring this evening, where our lines are open, and it will go through to the Cosmetic Skin Clinic and the private clinic. We will be sending out an email tomorrow first thing, just with the numbers of both clinics, should you have any further queries or should you wish to make an appointment with any of the practitioners. But let's kick it off really quickly. For the last few minutes, let's try and I'll try and do, some really hairy questions as well, if we can. Great question, and I'm going to really put the practitioners on the spot. So let's do some tricky ones. Why did Leslie Ash have such a bad reaction with lip fillers? And I'm going to just rotate you all. So let's go with Lee first. Why did Leslie Ash have and I'm so grateful to Leslie for being so open and has discussed her journey with this. But in a nutshell, Lee?
Well, she didn't have a hyaluronic acid dermal filler for one, and she chose to have a permanent product, and the permanent product, unfortunately, was silicone. And this is problematic, obviously, when injected into the skin, because one, you can't reverse it, and secondly, it can't be surgically removed, and it just integrates into the tissues and just causes a complete catastrophic nightmare for patients. And it was such a sad, tragic thing that happened to her.
Yeah, it was awful, but thankfully we don't use those. And just to say, we can dissolve these fillers. So one thing we haven't touched on this webinar is that these fillers are dissolvable. And God forbid, if something happens, we can get rid of them. Thank you, Lee. I'm going to whip through. How much swelling is there after dermal filler treatment? I'm going to put this out to Joe Ward. How much swelling is there after a dermal filler treatment?
So the new modern, sophisticated hyaluronic fillers swell relatively little, actually. The walk of shame of having to leave a clinic is virtually gone these days. Most people will, with the newer products, will have their treatment and will be able to continue with normal activity.
Yeah, thank you. Yes, it's amazing. This is a tricky one. Dr. Christou, how do you know when enough is enough?
Oh, okay. Yeah, sometimes you don't know until you just do a few little bits and see how the patient responds. So don't commit to a big treatment plan. Whenever you have a consultation with a practitioner, don't commit to a big treatment plan. You need to have a holistic consultation. Look at every different aspect, but start small, lay the foundation, let it settle down, build on the look. So as Tara mentioned earlier, she did a treatment over 4 different appointments. Don't do everything in one go. Do a bit, let it settle, see how you respond, and just kind of tweak and refine as time goes on, rather than everything in one go. One other element to this I want to just touch on is the relationship with your practitioner is very important. You need to feel free to express any fears you have, any concerns you have, what your goals are, but the practitioner also needs to feel free to say no if they feel the treatment is wrong for you. And so the more you invest in getting to know your practitioner and being honest with your practitioner about what you want, the better and better treatments are over a period of time.
Very nicely answered. Thank you very much indeed, Joanna. Yeah, it's about trust. Trust is a biggie. And developing relationships with your practitioners. If you don't trust the practitioner, you're in trouble. You've got to develop that relationship. Tara, are there any precautions I have to take to have fillers? So I think more of this is, who is not a candidate for filler, and what should they do beforehand, and maybe what should they do after?
So nearly everyone, apart from those who are pregnant and breastfeeding and immunosuppressed, we would say, maybe shouldn't have any fillers. And then prior to your filler, if you want to sort of, try, most of the time we don't get bruising. All of us are very skilled, highly trained practitioners using cannulas. We use these soft-ended cannulas, so we don't tend to get the bruising. But I always say to my patients, not too much alcohol the week before you see me, not too much, no aspirin, Nurofen. If you need to take any sort of pain relief, take some paracetamol, and no high-strength fish oils. All of those will help. We also use a lot of ice and compression in the clinic. We'll do our very best not to let you walk out with some bruising.
Lovely, but perfectly answered. Thank you very much indeed. Lee, can I ask you, it says, can you have fillers over the top of existing muscle relaxants? Can you use these things in combination over the top of them?
The answer to that is yes, you can, but not at the same time. So ideally, I would recommend that if you're going to have your toxin treatment, I would have that done first and leave it 2 weeks before you have any dermal fillers. And the reason for that is what you want to avoid is any swelling in that area that's going to cause the toxin then to travel into other areas and cause a negative effect.
Yeah, very nice. Thank you very much. Dr. Ward, is it possible to have lip fillers or lip lines filled without making the top lip bigger?
Absolutely, that's part of the skill. And I think when we as practitioners treat lips and the lines around the lips, we're very careful to be age appropriate, to gently soften lines, but without creating big protrusions and ledges and anything obvious. So yes, you can have lip filler and have it look natural, hydrated, plumper, more beautiful, but not obvious. So yes, in skilled hands, and I do think lips are like tear troughs, a very skilled, unforgiving area for a novice, but we're all advanced injectors. And so yes, we can do that easily.
Lovely, perfectly answered. Thank you very much indeed. Dr. Christou, are you able to lift the area above the eyelid to assist with drooping eyelids?
So the upper part of the face does lose volume as well as the lower part of the face. We've spoken a lot about cheeks and jawlines, but actually temples and even foreheads do lose volume. So fillers can be used in these areas. The forehead is quite a tight space. You need to be very careful. You don't want to add bulk here, but by anchoring this area, you can just sort of mechanically lift and support. This combined with a couple of other modalities of treatments like tightening treatments or toxin is the best approach, because you don't want to put too much filler up here and widen the upper part of the face. But it's certainly doable, again, in the right hands. If there is sufficient volume loss here, you can certainly use a filler in the upper third of the face.
Lovely, perfectly put. Thank you very much indeed. Tara, because we were talking about you know, doing these sophisticated approaches, temples, cheeks. Someone's asked a very good question, actually. They've said they have quite deep nasolabial folds, Tara, and said, but have we stopped treating them? Can we still treat them? You know, is it old hat, or can we still treat nasolabial folds, Tara?
It's perceived as a bit of old hat because, like you said right at the beginning, Tracy, you know, when we first started, you and I were just always chasing lines, and now we're all, then we were volumizing, but now it's all about support. So often when we've achieved the support, which, as Joanna says, once we put the foundations in, we often don't need to treat this because our fat pad that was sitting here is now back here. But I do still see patients, particularly my slightly older patients, who then have an actual line here or a fold. And I just finish it off, and it's like that sort of phase 3. You know, that's when we know we haven't put too much in, and we say, let's just tidy up, just finish off and treat the nose to mouth lines. But as a starting point, on the young patients, I often do treat them, but middle-aged patients, I don't. And older patients, I don't. It's not my starting point because you will not get the correction. You're kind of wasting your budget if you start filling here. You need to support here.
I just want to say one thing to people who are trying to get through on these phones. If somebody's, apparently there's quite a lot of people trying to get through, and it may go to an out-of-hours service if the lines are overloaded. Please don't worry. Tomorrow we'll send an email with other phone numbers too that you can call tomorrow when you'll have a full complement of staff. So please do not worry about that. Someone's asked, Lee, actually I'm going to answer one if I don't mind, because it's one of the contentious ones, always for me the most interesting. Somebody asked, could anything go wrong? And if so, how do you resolve any issues? So the honest answer to that is, of course, this is a medical treatment that needs medical skill. And of course, things go wrong. But the reality of life is this, that actually the more skillful somebody is, the less likely things are to go wrong. So my answer to this question is this. I've always felt very strongly that nobody should do a filler treatment who isn't skilled enough to deal with the consequences if something doesn't go well. And that has always been my mantra. This is why there's only medical teams that inject in our clinics. But in reality, very rarely can anything go wrong. When you've got very skillful people, the risk is very, very, very small indeed. And so what we do when you come in is largely these treatments in experienced hands are very safe, but we will talk you through, as anybody would doing any medical procedure, all the pros and cons, but generally speaking, it is a very low risk procedure. But we are there to support and help if you need any help or advice with anything at all. So that's something you need to discuss with your practitioner. It sounds fluffy, but it's not. It's simply saying if you go to experienced people, you're very unlikely to get issues or complications. Common things are common, you know. Though we try not to have bruising, occasionally give someone a bruise. You know, sometimes things do cause a little bit more swelling than they should in the short term, but that is very rare. But on consultation, there is transparency and you will know what you're going in for before you have it done. It's very, very important to ask all those questions. Just to say, Lee, someone's asked, how is Profilo different?
Well, Profilo is different because it's not a dermal filler. Profilo is an injectable moisturizer, if you like, and also it enhances collagen. So it doesn't volumize as the other dermal fillers that we use. It just causes moisturizer to the skin, and it's really, really good for people that have crepey skin in the neck and crepey skin in the face. But also, it's very good to enhance skin that doesn't have crepiness. and just gives that beautification in the skin.
Yeah, very nice answer. Thank you very much. Somebody's asked, and this is to go to Joe Ward. I've had the filler 3 months ago, but I might like a bit more. Is that okay? It's a nice straightforward one, Joe, isn't it?
Yeah, absolutely. So as we were talking about earlier, we often do stage treatments. We might do an initial treatment, wait a couple of weeks, add a little bit more volume or filler to a necessary area. So if you've had filler 3 months ago, it's settled and integrated nicely now into the skin. So if you feel and your practitioner feels like you could take a little bit more and that it would enhance your result, absolutely, you can add more at 3 months.
Thank you very much. This is a nice topical one. Do you have to leave, Dr. Christou, do you have to leave a minimum number of days between a COVID jab and fillers in the face?
So this is an interesting question because we don't really have solid evidence for this. But anecdotally, because how the vaccination works in interacting with our immune system, what we wouldn't want to do is introduce something else for the immune system to deal with within the same period of time. So as a body of experienced professional people, we have kind of come to the conclusion that 2 weeks before or after is a safe time frame between the vaccination and the fillers. Now, there's no real evidence for this per se, but if you do leave 2 weeks, it keeps you in a very safe space and you're not likely to have any interaction between those two things.
Lovely, thank you very much indeed. And again, we would advise on that when we see you. Tara, this is an interesting one. Can fillers be used for the neck area? And I'm going to extrapolate that, or to improve the neck area.
Yes, they can. And why I'm slightly hesitant, because the neck is a great concern for many women, but it's not always a big responder. So one of the fillers that we do pop in is the Profilo, like Lee just talked about. So we use Profilo because it's not going to give any volume, but it's going to hydrate the skin. So often the neck is an area that we really do use a combination approach, either using our Morpheus 8 machine, our therapy, sometimes a little bit of toxins, these little muscle bands that are depressing, but actually Profilo is a very nice area to put. So Profilo is a hyaluronic acid, but it's not something what we call cross-linked. So it's never going to give us lumps and bumps of volume in the neck, but it's going to hydrate it.
Yeah, beautifully put. I think the thing with necks is we can get great results, but we often have to use 2 or 3 treatment modalities to optimize the results. And nowadays, yes, technology like Morpheus 8, for example, combined, as you said, Tara, with other hydrators, skin hydrators, can actually give very nice results. And if people are prepared to have that, they get very nice results indeed. Lee, how do you treat marionette lines? Support elsewhere, or treat the lines, or both?
Yeah, that's an interesting question. So I would treat elsewhere before I treat the marionette line, because it's all about support. And when you, like you were saying, Tracy, when you start getting this mental fold down here and the lower part of the jaw starts, actually when we get older, we reabsorb bone. So we reabsorb bone around the jawline. So that's where our support starts to come in. And also the other thing, I always go to, if I'm going to treat the marionette line straight away, I always choose the marionette line that's the worst first of all, because that one's always the trickiest to treat, to give it support.
That's a really good point. Yeah, so you always do the worst one first, do you?
Yeah.
Yeah, that's really good. I think we've answered some of these, but just this is interesting. Again, quite challenging questions, which are great. It makes us think, and these are the questions we're asked in clinic every day. Is radio frequency safe to do after fillers? So I'll put that out to Joe Ward.
Yeah, so I wouldn't do it immediately after fillers. Once you've had your filler, I would allow it to settle into the skin. There is a period of time that fillers require to settle in, to integrate into the skin, and they work like a sponge by absorbing water. That's what high hyaluronic acid does in our tissue. It draws water and moisture towards it. So when we place the filler, we want a period of time for that settling and integration to happen. So I always say to patients, give it about 2 to 4 weeks to let that treatment take its full effect, and then you can proceed to have your other treatments or therapy, radiofrequency, needling, whatever it is that you might also have in part of your treatment plan.
Yeah, thank you. That's really, really useful. Somebody's asked, how do you treat crepey lines? Dr. Christou, Joanna, what would you say there?
Yeah, crepey lines could be
around the eyes.
Multitude. Oh, on the eyes. Okay.
Yeah, sorry. Yeah.
Sorry, no, that's okay. Yeah, so we have to assess to see what is the sort of predominant cause there, because if there is an underlying loss of volume, you probably do well to first replace that and support that. Aside from that, conditioning the skin with some very gentle injectable treatments or resurfacing treatments, and Lee is very experienced with treating some of these lines around there with some of his resurfacing type of treatments. So this sort of multimodal approach, but I would first underpin and support and then just sort of airbrush the surface of the skin with a couple of different options there, but each individual needs to be properly assessed and tackled sort of in that way, in that order.
Thank you very much. I'm sorry I sound a bit disturbed. There's such brilliant questions. I'm just looking at all these wonderful questions. We're going to wrap up soon, but I'm just going to try and pick the most. There's so many, and thank you so much for engaging with us like this. You know, amazing questions. Thank you, Joe. Tara, this is interesting. If you've already had filler, here's the question. If you've already had filler, is it safe to have more or mix different types of filler in the same face? So the question is, if you've already had filler, is it safe to have more? I.e., can you mix different types of filler in the same face, or are they all the same? That's a hard one, Tara.
Well, it is safe to have different brands of hyaluronic acid in your face. It is safe to do that. What I find, I don't tend to mix them in the same area. So if I'm putting one brand in the cheek, I might be using another brand in the jawline, because, you know, we've been injecting a long time, Tracy, and we have our favorites, we use all FDA approved fillers, but I've got, sometimes I'm treating these very fine lines here.
So we're just breaking up a bit there.
All of them, and fantastic. If I don't tend to layer,
carry on.
Sorry, was I breaking up?
You were there, but carry on. Sorry, you're not now. You tend to layer.
So yes, I think you can layer. As long as it's hyaluronic acid, a different brand on top of it. I don't tend to in the same area, because I have my go-to favorite products from all of the 3 brands, the FDA approved fillers that we use, because they're all lovely fillers, but we all have our favorite fillers for different areas of the face.
Yes, thank you very much. And just to add to that, you can actually, and as Tara's alluded to, we only use things that are safe. But, I have in the past and used products that stimulate collagen more. They're sort of collagen regenerators like Sculptra, for example. We're here to offer the best advice. So we are going to touch on these things as Tara has there. So we can use at different stages along a process to optimize and get better and better results. We can use treatments that are safe, but that regenerate more collagen at deep level, like Sculptra, there's others in the market, and then put hyaluronic acid fillers like Teoxane or Juvederm over the top, and you then build and build and build. It is very much, I mean, again, I speak to patients in quite flowery language, but it sort of explains things more in the philosophy of how we work. It is like a piece of art. Your face, you know, we're there to work with you to gradually get the best result we physically can. And sometimes that does take, different injectables. But yeah, we tend to always default to the hyaluronic acids more nowadays because they are so forgiving and they work so well, and it's brilliant. Someone has asked a tricky question, and somebody said, let's talk about cost. Of course, we have to talk about cost, but that's the sort of thing we do when you're in clinic because it is bespoke. I was once asked by a journalist quite what could be perceived as a tricky question. And she said to me on a live chat, Dr. Mountford, do you believe you get what you pay for? And I said, yes, I absolutely do believe you get what you pay for. And that isn't an excuse to charge extremely high fees. But what I meant by that was that I think that, and someone has alluded to this in another question, said how come some people can do very cut price deals? And again, I'm not there to judge what other people do. That's not what I do. But I think generally speaking, when you're using very sophisticated products in very sophisticated ways, injected by very, very artistic, experienced people with a very strong, history in the industry and with a very high safety profile, I actually think you do get what you pay for, yes, because it's very easy to stick a needle in someone's face and put a bit of filler somewhere. And sometimes it looks all right. But what we want to do is actually not do that. We're trying to achieve absolutely amazing results that are unique to you, delivering exactly what you want for the right time in your life and to actually be imperceptible. And that is much more difficult to achieve than just, doing this a basic treatment. And that's what people, to get an understated, beautiful, balanced look is far harder than to just bung a bit of filler in a lip or in a cheek and, job done. It's got to look beautiful. So I do believe you get what you pay for. Just to wrap up, because there's so many still on, but let's just do 4 more questions and let's wrap up. Let's do some interesting ones. Lee, how do I find a good cosmetic practitioner? Come to us.
Yes, come to us.
No,
of course, that's the easy answer. Do your research. Look who you're going to. Look into them. That's the key point. Is research your practitioner. Look at their credentials. Are they, make sure they're medical. Yeah, it's true. Do your homework, and and do more of these. Find out more. We're trying to dispel myths here as well. And of course, we are going to talk the way we talk, but we are here to dispel myths, and there's a hell of a lot of myths. This is a hard one, but I'll put it out there. Maybe you want to pitch in. Dr. Ward, Joe Ward, can filler help reduce nasal flare?
Yes, if it's carefully placed, it can. Like you were saying, when we were looking at the lady where you were trying to feminize and soften her face, yes, if we place filler in appropriate places, we can support the nose and reduce nasal flare, reduce the depth of this triangle at the top of the nasolabial fold. So yes, we all have these tricks up our sleeve that we use over and over again in clinic. We know exactly the right amount that most people will use. And so absolutely these kinds of things can be done. And just going back to what you were saying about cost, Tracy, one thing that I once heard someone say is nobody asked Picasso how much his paint cost.
That's a nice one. It's really good. Yeah, I mean, I think we know that these things are technically sometimes very hard to do, and to do well can be hard. So thank you for that. It's a good one. Dr. Christy, how are fillers broken down in the body?
Well, everything that goes into the body does get broken down and metabolized and excreted over a period of time. We won't go into details, but essentially, you know, because it's not a permanent product, so the enzymes within your body does just slowly break it down over a slow period of time, and it's a process that you won't feel, you won't be aware of it, you won't know it's happening until clinically you think, you know, oh, that's changed, let me get a top up. So it is nothing to worry about, but your body just gently metabolizes things, and the rest is perhaps not to be discussed, but yeah, excreted. There we go.
I think Dr. Christie is saying it's a bit graphic. Not that we're being cagey, but no, we understand. Metabolized by the liver and excreted through the bodily processes. Thank you very much. Tara, I really want to end on a real tricky one here, but that would be mean. Somebody has challenged, actually, let's just challenge what we were saying about dermal fillers can, you know, because they stimulate collagen, that people don't go back to the way they were before. Can you just, because somebody said surely after 10 years they're going to, you know, go back to the way they were before. So can you just elaborate on that before I wrap up?
Am I getting the, so if are you saying if a patient hasn't had any filler for 10 years?
No, sorry. Yes.
Sorry.
What is, because we were saying would lip lines get, when somebody was saying surely after a certain number of years, you know, you will eventually go back to the way you were before when the fillers break down.
Yes, you would if you, yes, you'll go back to your pre-baseline before you've had inject. But do you know what I find is very rarely do our patients not come back for more filler. I do find that even when budgets sometimes change, you know, as you said, you know, our biggest, often if you want that kind of transformation that we've shown you in a lot of the before and afters tonight, if you want that kind of transformation, you are going to have to put some investment in there, and that's going to be your biggest budget. But your maintenances are all going to be generally about a third. If you've ended up with a full face rejuvenation with 6, you know, we often say 1 mil per decade. So in my case, it's nearly 6. But my maintenance is nothing like that. My maintenance is
minimal.
You know, if I'm lucky, in therapy once a year and maybe 1 or 2 syringes. So if I stopped having filler now, it would be years before I would look like I did. I can't remember.
You would have looked without. I've got it. Yeah, that's good. Thank you. And just anecdotally, it's quite interesting, actually. There are some areas, it's quite bizarre, actually. And I do understand what the question meant. Where frown lines, for example, when we fill frown lines, nowadays we tend to use muscle relaxants. But I still, you know, and some of my practitioners still fill frown lines because sometimes they're jolly deep and they need some filler. I absolutely can say with that I have seen patients years later where those frown lines never seem to have come back. And I think that's actually because it stimulated a lot of natural collagen, the physical injecting the filler. So that's really, really interesting. And, you know, finally, I will end on a high. We are very passionate about what we do. It's obvious that we are. It's obvious that, but there is nothing that's worse for me as a practitioner who's used fillers all my clinical lifetime to see such bad results. Sometimes, as I touched on earlier, sometimes the people that generate this feeling of concern about fillers has been the celebrity world, where it just can look so bad. So actually, I would say that, you know, that puts people off. It makes them think that's the way all filler treatments look. And I hope if we've done one thing tonight, we've actually said it doesn't need to look like that. Good filler work is superb and just looks beautiful. And again, just to end on this, somebody once said, if I had to take one thing away on a desert island, to, you know, one thing, would it be, you know, concealer, mascara? Would it be, you know, my cool sculpting machine to, you know, I said, no, it would be filler. Filler would be something that I'd go to every day and twice on Sundays. So that's my fillers are my thing, and I've enjoyed this evening, and we thoroughly have enjoyed talking to you. And thank you so much for all the questions. You've sent so many, and those of you that we couldn't answer, we will endeavour to answer for you when we see you, or on email, or even by phone call. But thank you so much for staying online, and thank you so much for engaging with us. And just a final note, because we have been inundated, our call handlers, I gather, I've just got this emergency text, are overwhelmed by the number of calls, and we are going to actually send out an email tomorrow, as I've said, for numbers to contact us on, because you're probably getting an out of hours service now. So many apologies. Thank you so much for joining us, and hopefully we'll see you all in clinic very soon. Thank you, everyone.
Good night.